Hi, my name is Yarik Ortiz. I study University Catholic of Santiago of Guayaquil. My topic, ovarian cancer surgery. My definition, the usually means removing the uterus. The operation is known as hysterectomy of ovaries, and the fallopian tubes and cancer beginning with cells in the body beginning to grow uncontrollably. Cells is almost any part of the body can become cancer and spread.
So in the United States, each year, roughly 20 to 22,000 women are diagnosed with ovarian cancer. Ovarian cancer is actually a spectrum of diseases, which the majority of them are high-grade serous cancers, and that's the most common type of ovarian cancer, and they start in different portions of the ovary and can spread to different areas within the abdominal or pelvic cavity, but also to the other GYN organs. Most patients present with abdominal bloating, abdominal discomfort, changes in their bowel habits, or even just this general feeling unwell. These are the most common presenting signs of ovarian cancer, and unfortunately they represent signs and symptoms that do present at advanced stage disease. When it comes to treating ovarian cancer, the bulk of patients present with advanced stage disease, so a combination of surgery and chemotherapy is almost always utilized. With respect to patients with early stage ovarian cancer, many of these patients can be dealt with and be surgically treated alone without the need for chemotherapy. But a sequence of chemotherapy and surgery, or surgery then chemotherapy, is the way most patients with advanced stage ovarian cancer are treated. One of the most challenging things when it comes to dealing with ovarian cancer has to do with the way it spreads. Ovarian cancer typically doesn't just start in a central area and spread to things that are nearby. Fragments of tumor can be disseminated throughout the abdominal and pelvic cavity. So each of those tumor fragments that spreads from the ovary can land on different organs within the abdominal pelvic cavity and grow larger. So a large number of organs can actually be affected, and the most influential factor when it comes to patients' survival and prognosis when it comes to ovarian cancer is a successful surgery. Okay, and so the surgery itself can be very complicated in the fact that all of those tumor implants have to be addressed at the time of surgery. Now,
Nursing application. Nursing care process applied to a patient with ovarian cancer. The application of the scientific method in nursing practice is the method known as the nursing care process. The method allows nurse to provide care in a rational, logical, and systematic way.
Unfortunately, in this day and age, the majority of ovarian cancers present at a late stage. Statistically, 80% of all ovarian cancers present at an advanced stage, either stage 3 or 4. Treatment options for those patients usually requires a combination of both surgery and chemotherapy. New advances in ovarian cancer at this point in time really rely upon what we call adjuvant treatment for ovarian cancer. And what I mean by that is surgery for ovarian cancer, as for several decades, its main goal is to what we call surgically debulk the cancer. And what that means is remove all the macroscopic or all of the disease that we can see or touch at the time of surgery. Many times we can't remove every single piece of cancer that we can see or feel, but the goal is to leave as little a nodule of cancer behind following surgery. And what we strive to do is leave any cancer behind that will be smaller than 1 centimeter. That's the goal. And from a surgical standpoint, that may require removal of parts of the intestinal tract or urinary tract, etc. But surgery's goal is to remove the large pieces of cancer and leave the smallest amount of residual tumor behind as we can. And that's what chemo.
Pro and cons process. For grade 1 tumors, also called low-grade, most women do not need any treatment after surgery. After surgery therapy is recommended for at least 6 cycles. The combination of carboplatin and Plaxis is months after use.
Ovarian cancer is a rare but devastating diagnosis. One, surgeons say they're finding new ways to treat. And while the technology isn't new, how it's being used is.
We have used it in the past for gastrointestinal tumors of very specific types.
It's called HIPEC, which stands for hypothermic intraperitoneal chemotherapy, a cancer treatment that's now being used on patients with ovarian cancer.
With the installation of heated chemotherapy, that we actually are showing another step forward in both survival as well as progression-free intervals in women that have advanced disease.
Patients who qualify for this procedure will typically undergo chemotherapy before surgery. Once in surgery, doctors will use a laparoscope to look for any remaining signs of cancer.
We will place a laparoscope on the inside. We visually can inspect the abdominal cavity. With that, make a judgment whether or not we can remove the tumor. About 80% of the time we can.
Then surgeons will activate the HIPEC machine.
2 catheters are placed within the abdominal cavity. We close up the abdominal cavity just as if we were completing the operation, and then literally cycle heated chemotherapy through the abdominal cavity that is preheated, predetermined, and pre-measured.
The chemotherapy will cycle through the abdomen for 90 minutes in an effort to eliminate any remaining cancer cells. After that, surgeons remove the HIPEC and complete the operation. After surgery, patients may need 3 more cycles of chemotherapy before they're finished with treatment. A new procedure that doctors say is saving lives and giving hope to women with advanced stages of ovarian cancer. For Lee Health, I'm Lindsay Morton.
Problem appeared in Ecuador. In Ecuador, the risk of developing cancer before the age of 75 is approximately 12% and constitutes a major public health problem. With an increasing index, the information available on the incidence and distribution of malignant tumor is a base of the produced population-based cancer registry. Conclusion: ovarian cancer is the 5th leading cause of death in women. Approximately 16% of women who are diagnosed with ovarian cancer are over 62 years of age. There are 3 main types: ovarian tumor, epithelial tumor, green cell tumor, and stromal tumors. Epithelial tumors are the most common type of ovarian tumor. Women who have one or more family members who have or have had ovarian cancer, breast cancer, uterine cancer, colon cancer, or rectal cancer are an increased risk of developing ovarian cancer. Thank you.